Good morning, good afternoon, good evening. Welcome everyone to today's webinar on the Family Planning Handbook, a global handbook for providers. My name is Nandita Tate with the WHO IBP Network, housed in the Department of Sexual and Reproductive Health at WHO, and I'm thrilled to be moderating this session with you today. This session is being co-hosted by colleagues at WHO, the Johns Hopkins Center for Communications Program, IBP Network, and our partners at USAID. We have a very exciting and full agenda for you today. We'll start with some welcome remarks from James Kiarie from WHO. We will then hear from colleagues about the new updates on the FP Handbook. So we'll hear from Lyn Gaffield and Asantesana Kamuyango from WHO. And then our colleague Heather Finn from JHU-CCP will talk us through how to access the handbook both online and as hard copies. In the next part of the agenda, we will hear from partners in the field and how they have used the handbook for training, digital adaptation, and clinical guidance. And we're very happy to have colleagues Stembile Mugore from World Vision, Sarai Malumo and Rosemary Muliokela from WHO Zambia, and Jameel Zamir from IPPF. Time permitting, we will have time for question and answers as well as some discussion. And then we will close with some reflections and closing remarks from Shaimi De Silva from USAID. A few housekeeping notes before we start. Remember that this webinar will be recorded and you can access it on the WHO Media HRP YouTube channel towards the end of the week. Please submit any questions you have using the Q&A box at the bottom of your screen. Our guests will try to answer them as they come in, and if we can't get to all of them, we will try to respond to them after the webinar. And finally, you can download handouts, including today's slide deck, after the webinar from the IBP Network website. That's listed on your screen. So with that, I would like to introduce our first speaker, Dr. James Kiarie. He is the head of the Contraception and Fertility Care Unit at WHO in the Department of Sexual and Reproductive Health and Research. James, I'll turn it over to you. Welcome.
Yeah, thank you so much, Nandita. And colleagues, it is so good to join you in this webinar. It's really an exciting time to be seeing the launch of this global handbook. And I think this is the first webinar where we are trying to reach out to a broader group after our launch at ICFP. So just wanted to say a few words about our unit, the Contraception and Fertility Care Unit in WHO. This is part of the Sexual Reproductive Health and Research Department. And mainly our department and particularly our unit is engaged in guideline development and dissemination. And the Global Handbook is really part of one of our key products around contraception. But we also do work on infertility and fertility care more broadly. Beyond guideline development and dissemination, we also provide technical support to member states, which we focus on supporting guideline implementation, but also on supporting scaling up of evidence-based interventions. We know that developing guidelines and even disseminating them is not an end on its own. It's only effective if those guidelines go ahead to be implemented, if the interventions are scaled up so that they reach a maximum number of people, and if they are scaled up in a way that has quality and that really respects the principles of choice. And the third thing we do is through the Human Reproduction Program, we also engaged in research, and mainly this is research around implementation, looking at how we can support programs in member states. So that is it about our department and about our unit. And it's really also a very great time that we get to launch this on the 29th of March, and that our keynote speaker to talk about the handbook is Dr. Lyn Gaffield. Lyn Gaffield is really a wonderful and professional colleague. We've worked very closely with her for more than 10 years in WHO, and she has been a pillar to our guideline development and dissemination work. I think many of you already know her from working on the medical eligibility criteria, the selected practice recommendations, and a lot of support that she provides to countries to really adapt and adopt WHO guidelines and make plans on how to implement these guidelines. I think the greatest thing about Lyn is that she has really kept abreast with the evidence around contraception safety, how it can be used, and who can be able to provide this method. Through the continuous identification and review of evidence, which she leads, we have really, over the years, been able to maintain our guidelines up to date and to ensure that they really reflect the best of evidence. Unfortunately, Lyn will be retiring from her position in WHO, probably moving on to explore the world. Will be, of course, pestering her always to come and help us. She will leave a gap that is very challenging for all of us to fill. But we've really benefited from her knowledge and her skills in guiding the processes of guidelines in WHO. And really to highlight how important this has been, the process that we use to keep the family planning guidelines current has actually been adopted by WHO as part of what we are calling now the living guidelines, so that guidelines are updated as new evidence arise. And the family planning guidelines have really been the source of a lot of learnings for the entire organization. So I'm thrilled to be listening to Lyn, but also in some way sad that she'll be leaving us. Of course, we are wishing her all the very best in the next phases of life. We all recognize that there must be life outside WHO that is probably quite interesting and important to pursue. And we really look forward that our paths will keep crossing. So back to you, Nandita. And Lyn, I must say we are all very proud of you. We are sad that you are leaving, but we do look forward to keeping on interacting with you. You have done really great. Very few of us can claim to leave the kind of impact that Lyn leaves behind and legacy that she leaves behind in our organization. Thank you, and over to you, Lyn.
Thank you. Thanks, James. And just to echo James, Lyn has been a mentor to many of us at WHO and those of us working in this field. Really, Lyn, you need no introduction. You've really done an amazing amount of work. We all know about the MEC and the wheel and the guidelines that you've put forward. It's really a tremendous amount of work that you've led throughout your career. With that, I still will do a formal introduction. Lyn Gaffield is an epidemiologist here in the department, a scientist in the Department of Sexual and Reproductive Health and Research, and as we all know, has worked extensively on a number of family planning guidance documents and guidelines, including, but not limited to, the FP Handbook, the medical eligibility criteria, postpartum care, and others. So Lyn, I'm going to turn it over to you to walk us through the new updates in the handbook. Welcome.
Thank you, and thank you very much for the wonderful welcome and very kind words. It's been a complete privilege and honor to work with all of you. So I could say a lot more, but I want to give all of you who've generously taken the time today to join the webinar to hear about how excited we are to share with you, to produce, launch the 2022 edition of the Global Family Planning Handbook. So next slide, please. So as you've just heard, probably all of you are very full aware, WHO provides a suite of guidelines and tools that are meant to help inform family planning programs and policies and guide practice as well. We do this through the MEC, the SPR. We now have moved into the digital age with the MEC wheel moving to an app as well. The Family Planning Handbook, and we also are working closely with colleagues on self-care interventions. The Family Planning Handbook, just a little bit of history, is really the cornerstone of what WHO offers, and we do this in partnership with so many of you, and we couldn't do it without you. Now, let's go to the next slide. Just a tiny step back to say that probably all of you are aware, but since the mid-1990s, WHO has produced the Medical Eligibility Criteria for Contraceptive Use Guideline, which is now in its 5th edition. And this provides evidence-based recommendations on who can safely use a contraceptive method. And also, depending upon what personal characteristics, or if you have any pre-existing medical conditions, or your life circumstances, so to speak. This has been produced by an incredible array of experts from around the world, which I think is also the reason why it's been so well received, is we've all worked together on this guideline. This guideline is part and parcel within the Family Planning Handbook. Additionally, next slide, another key element in the Family Planning Handbook is our kind of sibling to the MEC, the Selected Practice Recommendations for Contraceptive Use. And it's now in its 3rd edition. And this is once a person has been deemed medically eligible to use a contraceptive method, this guideline gives guidance, evidence-based, on how to provide it. So it touches on topics like when to initiate, what happens if there are problems, if the person has accidentally, incorrectly used the method, maybe missed a pill, missed their injection appointment, is experiencing menstrual difficulties of bleeding. This guideline will provide you with additional information to provide safe and effective care. Next slide, please. But the reason why we're here today is because we are so very pleased to share with you the 4th edition, the latest update of the Global Family Planning Handbook. The handbook, the beauty of the handbook, which is actually first launched many, many years ago, it includes everything you need to know. So the relevant information from the MEC, the relevant information from the SPR, and importantly, as we'll discuss later today in this webinar, key information that frontline family planning providers need to know that may come from other WHO documents. We'll discuss that a bit later. So this is your go-to resource where everything is all there at your fingertips. As noted in this slide, we, along with many colleagues and support from other organizations, the earlier editions of the handbook have been translated into many different languages, and we'll discuss our plans for the translation of the 2022 edition a bit later in the webinar. Next slide. So probably you're like, please tell me what's new in this handbook. So importantly, we have retained, when you see the handbook, we've really retained the flow, the way the handbook is organized. So the handbook contains many chapters addressing specific methods of contraception, and then there are about 5-6 additional chapters that provide additional guidance depending upon the population or circumstance. So with that in mind, the 2022 edition includes a dedicated chapter on how to provide family planning for women and adolescents who are at high risk of HIV. I'll go into greater detail shortly. We also have a dedicated chapter on how to provide family planning, rather maintain services during an epidemic. And I'll talk a little bit more about this. Then my colleague Asantesana will give you additional details on the next the additional components in the handbook. We now have updated information on providing family planning to women who are post-abortion. We have expanded guidance on self-injection of DMPA subcutaneous, the injectable. We also have updated information in the chapter addressing sexually transmitted infections on cervical cancer prevention, screening, and treatment. And this is also because new guidance was issued by WHO after the 2018 edition was published. And lastly, we've also taken advantage to refresh, update the chapter dedicated to STIs because our colleagues in a different department issued a syndromic management for STI guidance in 2021. So this edition takes advantage of any additional new published WHO recommendations that either directly or are very closely linked to providing quality family planning services. Next slide. So a little more detail about this chapter 23, which is family planning for women and adolescents at high risk of HIV. Now this edition includes a new chapter because WHO, it's in response to new guidance from WHO, reaffirming the safety of contraceptive methods for women and girls at high risk of HIV. And importantly, it also brings in new guidance from our colleagues in the HIV department on HIV prevention and testing. So this brings us all together. Now, as we're all aware, some family planning clients are at high risk of acquiring HIV, and it's crucial that family planning providers and programs respond to this need. Next slide. And in particular, there are areas in the world where the proportion of the population living at HIV is high. And as a result, HIV testing and prevention needs to be included with family planning as a part of routine care. So this chapter offers expanded guidance that previously was discussed in the 2018 edition in the chapter dedicated to STIs. We've now, this new chapter dedicated to women and girls at high risk of HIV offers additional information on which family planning methods can be offered. Answer is all, with the exception of those containing non-oxyl 9. It also gives expanded information on which HIV prevention services should be implemented, such as who should be tested, how often, when should you be offering PrEP, when should you be offering PEP. And also it provides a lot more detail on counseling strategies for the clients who are at high risk of HIV, as well as their male partners. Next slide, please. And this map here, which is included in the chapter, really depicts that services need to be tailored according to the burden of HIV in the setting. And as you can see from the map, the burden is not evenly distributed, and it's not even evenly distributed within a country. So it's really important to know your epidemic and tailor your services accordingly. And lastly, just to say that as with most all chapters in the handbook, at the very end of this chapter, we have a section dedicated to commonly considered questions and answers. So you also may find that very helpful in the new chapter. Next slide, please. So as probably all of you have been discussing for the past several years, we now know that family planning is a service that is tremendously affected by epidemics. And we decided that it was really important to provide an additional chapter in the handbook addressing this various topic. Family planning providers need to balance the demands of responding to an outbreak, but at the same time, simultaneously providing family planning services. And we are aware that the impact of epidemics on reproductive health, as we saw with the Ebola outbreak, with the Zika outbreak, and now with the COVID-19 pandemic, that reproductive health can be affected by either directly by an infectious disease or affected through an indirect consequence due to the excessive pressure on a health system. Therefore, we thought it was extremely important to provide information on how possibly a service provision could be adjusted so as not to compromise high quality family planning services. So this particular chapter includes information on which methods can be offered safely and effectively. So for example, medical eligibility criteria, the 1 through 4 scale, does not change as a result of an outbreak or an epidemic. And this chapter also gives additional information, reminders of which methods can be offered without the need for a medical exam, or also those that may not need to be, could be continued or initiated without a visit to a provider. So this chapter gives a little more detail on self-administration. When possible, methods, we also underscore in this chapter that when possible, there are methods that can be multiple supplies, multiple month supplies can be offered. So pills, either COCs, POPs, ECPs, and also the condoms and the subcutaneous DMPA injection. And then lastly, this chapter also encourages the use of digital health technologies for provider decision support and sharing information with clients themselves. So this chapter includes links to WHO's mobile applications to ensure that providers have the information they need to provide services in the context of an epidemic. So with that, I am delighted to hand over the parole to my colleague, Dr. Asantesana Kamuyango, to continue with what's new in the 2022 edition. Thank you.
Thank you, Mary Lyn, for that great overview. And thank you again for all your work in this area. I would now like to introduce my colleague, Dr. Asantesana Kamuyango, who's going to talk through the other chapters, as Mary Lyn mentioned. Asante is a PhD in public health and is a state registered nurse midwife. And I will turn it over to her to go through some of the other new updates in the handbook. So Asante, over to you. Welcome.
Thank you so much, Nandita. It's so nice to have you here, and thank you everyone online for joining. So I'll continue with the next session, going on into the other chapters, other information that has been added. Next slide. So the 2022 handbook also includes information on post-abortion care, saying that information on counseling for any kinds of methods is actually essential for women post-abortion. And all contraceptive options can be considered if they fit into the eligibility criteria. Next. And we have also included some instructions on how to self-inject. This is available in the new handbook. We didn't have it before. So now we have some images showing how to self-inject, and providers should offer service for self-injection as an option for women who are eligible for this kind of contraceptive. Next slide, please. And on cervical cancer, we recommend that cervical cancer screening should start at age 30 years or at age 25 for those who are living with HIV. And every woman must know that cervical cancer screening is available. It's such a simple and quick and generally not painful test. Next. And also prompt syndromic diagnosis and appropriate treatment must be provided. And if it is not available in the clinic, please make sure to refer women for testing and treatment services in other places. And also provide counseling on STI prevention is recommended for women who come for contraceptive care. Next. The new edition has included information on gender equality and access to family planning. We are aware that every human has a right to determine whether, when to have children, and how many, and with whom to have them with. And we have to be aware of the needs of men, women, but also gender diverse people that do not fit into the standard of what we've seen so far for many years as the standard of gender. But if there are other people who do not fit that criteria and are gender diverse, we must look at their needs and be aware of them and provide the right appropriate care. And in the new handbook, we've included definitions for gender inclusion, diversity, and equity. It is actually in the front matter of the handbook, so be sure not to miss it. It's right in the beginning before the chapters begin. Next. We have also provided some details on implantation and also removal. So they're just extra images that we've included for providers to use that can be helpful when you want to provide implants to women. Next. And the handbook also provides some job aids and supporting resources. There are many, but one of them is this one. This is actually at the back of the handbook, and it shows you the effectiveness of different kinds of contraceptive methods and how to make sure that the method is more effective. So this can be used as a reference when you're providing care. Thank you.
Great. Thank you, Asante, and thanks to both you and Mary Lynn for that detailed outline of what's new in the FP Handbook. Certainly some very important information has been included. So thank you to all that worked on getting those chapters updated and included. Next, I'd like to introduce our next speaker, Heather Finn. She is Operations Lead on USAID's flagship knowledge management project. And she is going to be sharing with us how to access the handbook, both online and hard copies, and walk us through some of the other details of the handbook. So Heather, I will turn it over to you. Welcome.
Thank you very much, Nandita, and good morning, good afternoon, good evening. I'm very happy to say that I've worked on the handbook for many years, so I would love to walk us through the website. So if we go to the next slide, Nandita. So I hope this page is not new for everyone on this webinar. And if it is, please visit www.fphandbook.org. What you're seeing is the homepage for the handbook. And from the homepage, we can do several different things. What I just wanted to highlight briefly were some things I think are missed from a lot of people that visit, but we are actually working on some updates to make navigating the site a little easier. I also wanted to make a quick announcement that our website is designed for mobile first, which means that if you want to access it from your mobile device, even though this has a lot of content, it'll totally be formatted properly for your phone. So you can access it from your mobile device, a tablet, your laptop, workstation, what have you. So if you go to the next slide, please. So when you click on a chapter, which you can check on the left-hand side of the web page, and you want to get into a chapter, one of the things that a lot of people I think don't know is if you just want information for that chapter, you can click on the download chapter. This way, if you're just interested in combined oral contraceptives, but you don't need the entire handbook, or you don't have the bandwidth for the entire handbook, if you hit that button on the right-hand side, you'll see where a PDF would be formed. Next slide. But for those that are visiting, a lot of times you do want the entire handbook, and I understand that. So from the main homepage, where you see the yellow arrow pointing, it's a download button. When you actually click on the download button, it'll take you to the next screen. Next slide, Nandita. And here you will have access to all of the products that we offer on our website. So whether it is the full version of the handbook in PDF in various languages, which you can see, they'll be dated. We will also be updating the 2022 edition into several languages, which will be coming up shortly. You can download them as a PDF. We also have the wall chart is available, and it's available in multiple languages, all of which can be accessed from this screen. So again, go from the home page, click on download, and it'll take you to another screen in which you can download all of our products. Next slide. What I've been answering in the chat, and I know a lot of people are also interested, is how do I actually get hard copies of the handbook? Through the support of USAID, we are still able to provide some hard copies in English and forthcoming in Spanish and French. So in order to do this, you simply click on the order icon from the webpage, homepage. When you get to the order icon, it'll just take you to a simple form in which you fill out all of the appropriate information in order to ship the copies to you. And we do ask a little bit of background, how you intend to use the copies. But as soon as we get them from the printer, which again, answering a question in the chat, the English copies are actually being printed now and are forthcoming in less than a week. So I have some copies from ICFP that have been sitting waiting for the new edition to be printed and sent. And then again, we're currently working on laying out the Spanish and French translations of the 2022 edition. So those will also be forthcoming. And I just want to make a plug that we do, in fact, translate the entire website into Spanish and French. And if you look on this screen, even though it's not highlighted, you'll see an icon for English, Spanish, and French. Once we're done with the 2022 edition, if you click on either one of those icons, the entire website is translated. So all of the content is translated in HTML. So you can actually navigate that in the language of your choice. I think that may be it for me. I wanted to leave you with, a screen that shows you how to contact us. You can do it directly with orders@jhuccp.org, in which you can include all of the relevant information, or visit us at the web, fphandbook.org, and click on the order form. And if you do that, the requests come to my colleague and myself, and we'll be sure to get those copies out to you. So please visit the website, navigate the website, click on some of the things I've highlighted. And if you have any problems, my contact information will be shared. Please reach out to me. So in order to save time for the rest of the interesting stories, back to you, Nandita. Thank you.
Wonderful. Thank you, Heather. And thank you, everyone, for all your questions about how to access the handbook. And again, thank you, Heather, for all your work on this. Just to note that we do understand that this webinar is offered only in English, but we do have plans to offer a similar webinar session in Spanish and then again in French. And we are just waiting for some of that content to be fully translated. So do stay tuned for those of you or colleagues who are interested in a Spanish or French webinar that is coming in the coming months. So with that, we're going to now shift our focus from the content of the handbook to really learning and hearing about how partners have used the handbook in their work. And we are just delighted to have a set of speakers with us. I'm going to introduce our first speaker, Stembile Mugore, who's now with the World Vision US. She is a native of Zimbabwe. She is a trained nurse, midwife, and public health professional with over 20 years of experience in global health, including family planning. And we are just delighted to have Thembi with us to share with us some of her experiences using the handbook, particularly around training. So with that, I will turn the floor to Thembi. Welcome, Thembi. Go ahead.
Thank you so much, Nandita, and it's my pleasure to be on this webinar to share my experience with the use of the Family Planning Handbook by providers, program managers, trainers for both in-service and pre-service education. The experience that I'm going to share with you is from the time I was working with IntraHealth International on the Evidence to Action project that was led by Pathfinder, and it was the USAID flagship family planning project that ran from 2011 to 2021. I left that project in 2019, but having moved to World Vision doesn't mean that I've stopped being a champion for use of the Family Planning Handbook, because I've seen its importance, I've seen its use in the hands of both providers and trainers. So what I will share with you is really examples of how it has been applied and how I've also witnessed its use and its importance once it is in the hands of both providers and trainers. I think what we all know as a challenge is that availability of evidence-based resources at the front line in service provision is a major challenge. They are just not available. I think the same can be said even for nationally developed guidelines. They're just not there. They don't somehow filter to the frontline health workers. They end up on shelves at the national directorates, at regional or district offices, and may be accessible to very few trainers or to very few service providers that have attended trainings. And I think this is one area that needs to be addressed and changed. And Heather has shown us how it can be downloaded very simply and how hard copies can be ordered and distributed to frontline health workers. I will start with sharing what it means to have these evidence-based resources in the hands of service providers. One thing and one observation I have made with the handbook is that it's evidence-based, it's very simply written, it's well illustrated, but a major outcome that I've witnessed personally in my years of family planning training, my years of family planning service provision is just, it has debunked those myths amongst providers, or what I've always said, provider initiated practices, provider initiated eligibility criteria that are often barriers to contraceptive access by many women. And having the handbook in the hands of providers that they can go to if they are faced with a problem, or if they are faced with having to make a decision about eligibility, about management of side effects, about what to do in terms of questions being raised by clients, has been a major breakthrough from my observation. So we need to get that handbook in the hands of providers because it gives them something that is up to date. And by the way, I've seen that handbook being like the only one, those of us that have done facility readiness assessments, and you say, what guidelines do you have? You won't be surprised that sometimes the family planning handbook is the only thing that they do have in their hands. I've also seen the family planning handbook and supported its use in development of in-service training materials. including training of trainers in low resource settings, in very early onset family planning programs that are at the beginning, like in South Sudan. We use the handbook as the resource for developing in-service training materials, including for community health workers and for clinicians, and including the training of trainers thereafter. And I think that provided the opportunity, particularly for trainers who were also supervisors, to use that as a resource to be able to navigate how to access the information with ease as they needed. And one thing that I also observed during that time when we were training trainers is those illustrations that are in the handbook that Asantesana showed us are very, very useful, because lo and behold, one day I turned and they were using those illustrations for self-instruction, somebody reading, saying, do this and do that with the right anatomic models. They're able to use that handbook for self-instruction as well, to reinforce skills where before they practice those skills on clients. We use the handbook during pre-service education, updating pre-service education, the family planning component of pre-service training materials in Uganda and in Tanzania. And the handbook with other resources proved a very, very useful source of evidence-based resource for content. The handbook was current, it was available. They could just cut and paste cut and paste from the chapters, paste it into their curricula, and then adapt it and modify it to suit the language that they needed for their instruction. So having that handbook, from what I heard from a lot of providers, even amongst trainers, was that it helps them when they are sharing with their colleagues, when they are sharing after training, when they are sharing updates, because they are not sharing from the top of their head, or they are not sharing rumors, they are actually sharing scientific materials. Another area that I also heard of the importance of the handbook was regulatory councils, particularly in Uganda as well as in Tanzania, have to look at the evidence or the technicality of the content that goes into training curricula, and have to look at what is the scientific basis of that. And one of the trainers that I worked in Tanzania said, oh, no, we just accompanied our updated content with the handbook so that they could cross-check. And that, they said, facilitated a much faster review of their curricular content, and as well as its approval, facilitated quick approval because the handbook was available. But how do we get this handbook to the hands of frontline health workers, particularly right at the front? I think what is very, very critical is I used to have to carry handbooks. I used to order, when on travel, I used to have to take the handbook along with me, and literally when you went to a health facility, you distributed the handbook, and it always earns you a lot of appreciation from the service providers, because they inquire, they look at the handbook, and they think, yes, they needed this because it really is a one-stop shop for technical content, as well as self-instruction that has service providers, trainers, supervisors require. And I'm glad that this webinar is so well attended by different people at different levels, including program managers, including trainers, some of whom I'm seeing, and including service providers themselves, some of whom I've also met, that it's a resource that can be shared. It can be used for updating those service delivery guidelines from national level, updating the knowledge and skills of service providers, updating training curricula. And I think on that note, I will forever be champion of the family planning handbook. And I'm glad that it's very dynamic and it's being updated as it goes along. And thank you very, very much for this opportunity to share the use of this critical resource for family planning. Thank you.
Wonderful. Thank you, Thembi, for your inspiring remarks, and certainly great to hear about your years of experience using the handbook, and happy to know that we have a champion, as always, moving forward. Next, I'd like to introduce Dr. Sarai Malumo from WHO Office Zambia. Dr. Malumo is a medical doctor with a degree in health management and has about 30 years of experience in the health sector. And today we're thrilled to have her and a colleague with us to talk about how they've used the handbook in their work in Zambia. So Sarai, over to you. Welcome.
Thank you very much. And good afternoon, good morning, everyone. Yeah, so I'll just briefly share the Zambian experience on how we have used the family planning handbook. Next slide, please. Yeah, so basically our experience in Zambia, I think, is a bit similar to what my previous speaker shared. So when we developed the 2017 national guidelines, we got the information from the handbook at that time. And WHO provided the leadership for normative guidance, whilst the Ministry of Health, as our member state, provided the coordination, ensuring that all the stakeholders are part of this process. And now when we saw the 2022 family planning handbook released, I think it came at an opportune time when we all thought that we needed to update the national guidelines. And thus we convened a meeting to adapt the various sections of the family planning handbook. And this was by ensuring that all the stakeholders are there, and the Ministry of Health leading the process, and partners providing various supports, including funding. So in addition, the handbook has been used to introduce new methods that to increase expand the methods of choice in the different facilities. So we have used the handbook to do that, and also to generate the family planning training materials, which are being used for training health providers in family planning, especially long-acting methods. We have had general family planning training, and then trainings focused on long-acting methods, and also development of various job aids. And then the training institutions have also been using the family planning handbook to improve their curriculum, and also to ensure that they are training the trainees according to the WHO guidance and WHO evidence. So basically that's what we have used, how we have used the handbook, and it's always in short supply. I think many training institutions have wanted to access it, but now that they are able to access it online and also on the apps, I think this information will be really appreciated. And for the 2022 guidelines, we have already done the validation. I think it was done last month. So we hope that before this year ends, we'll have our 2022 Zambian family planning guidelines. Next slide, please. So that's just to show you the pictures. Our family planning guideline and protocol, and also we used the generic make will and the medical eligibility criteria to to have our own make will Zambianized, and we hope that we can print a number of copies. The number were printed and are being used during the trainings and also during the service provision, distributed in almost all the facilities. And that's just as an example of the job aid. So thank you very much. My colleague Rosemary will take it up from here. Thank you.
Wonderful. Thank you so much. I'd like to now introduce Rosemary Muliokela, also from WHO Zambia, who's going to talk in a little bit more detail about how they were able to digitally adapt the handbook in their work. So Rosemary, I will turn it over to you. Please go ahead.
Thanks, Nandita, and good morning, good evening, and good afternoon, everyone. And thanks to Sarai, I think she provided a great background to that. And I think for us, what was really exciting in Zambia, and this initiative we're working on with multiple countries, in Zambia is one of the countries where we're looking at the digital adaptation of the guidelines, is that we sort of went ahead because the guidelines, the global digital adaptation kit for family planning was already built off of the global family planning handbook, the 2022, the one that we're launching today. And so part of that process actually informed some of the process that Sarai was talking about. And so we were really excited about that. Next slide. So in this slide here is just the process of the adaptation process at country level, and we've been refining this in each of the countries we're working in. And so the first part was really to understand where is the country with the guidelines, establishing a common understanding on the digital landscape side as well as the program landscape side, raising an awareness of this process of how are we going to use the digital adaptation kits and smart guidelines, including the Global Family Planning Handbook and the National Family Planning protocols. How are we going to contextualize that and do the digital adaptation of the guidelines? And the next process was then to review, and I think this is where the Global Family Planning Handbook came in, as well as, you know, looking at the local protocols, what is in the system that we're going to be enhancing in country, because Zambia already had a family planning module, but it needed some enhancement using sort of the global guidelines that the DAC actually offer. And I was very excited to see in Mary Lyn's presentation that part of the considerations around the strategies for family planning, service delivery, digital health is actually a key component. And really the DACs provide sort of that underlining clinical guidance and content for that. And so the process of content alignment and reviewing what was in the DAC together with what was in the existing system, together with what was actually in the the Zambia National Planning Guidelines, and then to be able to align that and prepare what we're calling a DAC country package for family planning. And then the third step, which is we're sort of done now, although we still need to validate, is we do have a family planning package that again was built off of the Global Family Planning Handbook, as well as the national guidelines. We do have a package now. We're sort of going through the process of validating, ensuring that whatever has been added into the package is also aligning and responsive to M&E needs. Next slide. So this is just a picture, and as you can see from one of the workshops that we conducted in Zambia, we actually have, and I think she's actually on, and shout out to her, I think she's actually on the call this afternoon, the Chief Family Planning Officer, who was reviewing with one of the nurses in Southern Province in Livingston, where they were looking at the data dictionary in the DAC and then comparing with the MEC will for Zambia that was adapted off of the global MEC will, I think that Mary Lyn referenced. And there is a quote there that I'll read for you. And I like what Stembile talked about when she talked about capacity building. We saw in this process too that it allowed the clinicians to review the content within family planning, the guidelines, not only in the handbook, but also as well as in the digital sort of electronic format that was there. So we were building the capacity for digital health, but as well as their capacity for health literacy. They were able to go through the process and realize that, oh, you know, once we update our system using these guidelines or using the DACs, we'll actually be able to provide holistic care. So the quote there says, after going through the DACs, we have realized that we are doing a lot of shortcuts when providing care to our clients. DACs will not only force us to follow guidelines, but also provide holistic care to clients. This was from one of the nurses as she was going through the digital guideline for family planning in the workshop. Next slide. And these pictures are also just highlighting, and you can see Mary Lynn there. She came to support us in November of last year, where we were conducting sort of the content alignment and validating some of the content that was in the Zambia country package. And then that was the team. The last picture is showing the team that includes also some of our HQ colleagues, as well as Mary Lynn, Tunda from the regional office, and other colleagues within country that supported us through the process. Thank you.
Wonderful. Thank you so much, Rosemary. Very interesting to hear about that DAC process and hopefully something that others can replicate. Finally, I'd like to introduce our last speaker, Dr. Jameel Zamir. He's the Director of Programs for IPPF, based in the East to Southeast Asia and Oceania Regional Office. Dr. Jameel, I'll turn it over to you. Welcome. Go ahead.
Thank you, Nandita, and for this opportunity. And good morning, good afternoon, good evening to everyone. So my presentation is primarily to share with you how we have institutionalized FP Handbook for last many years, and it has become a primary source of FP information and medical eligibility criteria for all the clinics of IPPF across the globe. And not only that, it is also one of the QC standards for the accreditation system. So it is integral part of this process. What I'm going to really talk about is the transition from 2018 edition to 2022 edition. Next, please. So as you will notice that with the IPPF is spread in 145 countries with 34,000 healthcare service delivery points, in 2022, we reach out to 205 million SRS services, with 37% of those services are actually contraceptive services. And it's 42 million clients, those have received the contraceptive services. That's a spread. And for us, availability, accessibility, quality of family planning, human rights-based approaches is central to this work, which is also reflected in our recent IPPF strategy 2028. Next, please. So as you will notice, as part of integration, last year we came up with the guidelines, client-centered clinical guidelines, and this particular guidelines is actually directly for the healthcare service providers, and it draws heavily from the work of WHO, FP Handbook, and other technical guidelines and resources, and it focuses on the integration of SRS services along with FP, highlighting abortion care, HIV, STIs, cervical cancer, maternal health, SGBV services, and also in the humanitarian settings. And this particular FP handbook is actually complement this particular guidelines because it touches upon a range of SRH issues, but for FP, it is the FP handbook which goes along with it. And besides that, there is an exclusive chapter on contraceptives, which covers primarily from the WHO guidelines. Next, please. Next one. So as you will notice that in the application, the previous one, in the application of FP handbook for IPPF's clinical guidance, it goes through really a process of procuring and making sure that all our clinics static clinics have the handbook with them, besides sharing the e-copy which we have. So that really starts the process. And what we have seen previously, that most of the technical resources are being drawn from this handbook into the posters and pamphlets and social media and job aids. So that is being done by our member associations systematically in different languages. We have also used this for the lot of policy statements. Each member association in this country, they also have CSO networks, and they have used this for different orientation sessions and training programs. Now there are new areas that are reflected in the handbook. As part of our regular training programs, we'll be integrating all these aspects into our new training programs. And as I mentioned that our guidance on the client-centered clinical guidance, we are going to develop an app which is in process, which will also have reference to the WHO handbook in this document. Thank you.
Wonderful. Thank you, Jameel. That was really interesting and very nice to see how you've adapted the handbook and much of your clinical guidance throughout IPPF's wide network of member associations. Moving forward, I'm going to have to unfortunately let you know that we are out of time. So I don't think we will have time for question and answers and discussion right now during this webinar, but please do continue to submit your questions using the Q&A, and we will follow up with the speakers and try to have them answered directly after the webinar. So apologies for that. But we wanted to focus on the content. We had a great overview of the new updates, and it was also very wonderful to hear about how partners are using this particular guidance in their family planning work. So thank you, everyone. Lastly, I would like to just open the floor and welcome Shaimi De Silva. She's the director of USAID's Office of Population and Reproductive Health. And Shaimi will be providing some reflections on what we've heard today about this handbook. So Shaimi, over to you. Please go ahead. Welcome.
Thanks, Nandita. So being mindful of time, I just wanted to offer a few quick reflections as we conclude the webinar. Since 2007, USAID's Office of Population and Reproductive Health has been proud to support the production and dissemination of the Global Family Planning Handbook for Providers, in partnership with WHO, Johns Hopkins University, and a wide consortium of partners. We feel really strongly that this global resource provides essential clinical practice information for providers that enables them to assist individuals and couples to choose, use, or change family planning methods as they progress through their lives. And we're particularly pleased that this 2022 edition includes the 2 new chapters that Mary Lyn described, that including the one that provides guidance on family planning for women and girls in high HIV burden settings, aligning with the lessons from the ECHO trial, as well as the updated global recommendations for contraceptive eligibility, self-care, and provision of family planning in public health emergencies and humanitarian settings. Importantly, it really confirms that almost any method can be used safely by all women, and that providing most methods is typically not complicated. And indeed, most methods can be provided even where resources are limited. So with the information in this book and the right resources, providers can ensure that clients' reproductive intentions, life situation, and preferences govern voluntary family planning decisions. And this client-provider relationship, when grounded in evidence-based and skillful counseling, helps to inform clients' understanding of family planning benefits in general and of their chosen method in particular, including self-care practices such as self-injection, the use of condoms, and exclusive breastfeeding. So we anticipate that this edition will continue to help providers, as we've heard today, from our partners across the globe, to provide client-centered counseling and services And we look forward to continuing the work with our many partners to empower individuals and couples to plan their families and their futures. So many thanks to all of you in attendance for your commitment to supporting family planning providers wherever they may work across the globe, and for participating in this webinar today.